Good day. We are going to present the topic of the blood sample collection, routines of comfort consist in Ashley R.B., Diaz Carolina, Galaviz Alisa, and me, Alexandra Sanchez. The topics we will cover next are fears is introduction, objective definition and of the procedure, nursing fundamentals, equipment and materials needed, and script. As an introduction, we have the blood sample collection is a fundamental clinical procedure used to obtain blood for laboratory analysis. It helps diagnose diseases, monitor treatment, and assess overall health. The process must be carried out using proper techniques and sterile equipment to ensure the reliability of test results and patient safety. Our main objective is to describe the procedure for blood sample collection, identify the necessary equipment and materials, and highlight safety precautions to ensure accurate and safe sample um, subfill.
Definition: blood sample collection, phlebotomy, or capillary puncture is a standardized and aseptic procedure through which verify blood and obtained for diagnostic, therapeutic monitoring, or serological testing. This procedure constitutes the pre-analytical phase of the laboratory process and must adhere to institutional and international standards to ensure the accuracy of test results and the safety of both the patients and the healthcare professional. Nursing foundations. Blood sample collection is a common yet critical nursing intervention. Its correct performance minimizes pre-analytical errors, prevents complications such as hematomas, infection, or syncope, and ensures accurate laboratory outcomes. Nurses play a key role in performing the procedure, maintaining aseptic technique, ensuring patient safety, and documenting every step of the process. From the nurse care perspective, the primary goal is to obtain an adequate and representative blood sample while preserving the patient's comfort and safety. This includes appropriate patient preparation, emotional support, pain control, and prevention of adverse events during and after the procedure.
For the blood sample, we will need some basic and simple elements, such as the tourniquet, that we will use it for stopping the blood pressure. The next one are the sterile sirens and needles that we will use for extracting the blood. Then we will need some alcohol cottons for making the sterilized step. Then we will need gloves for stopping any contact with the blood. Then we will need the tube of the contact tubes that we can use some different ones that are the blue one for biochemistry, the yellow one for time of ovulation, and the red one that is for blood chemistry. And at last one we will need the labs for in analyzing the results of the blood.
Hi, good afternoon. How are you?
Good, thank you.
Well, I'm glad. My name is Sophia, and I'll be the nurse who will be taking your blood sample today. Okay? Before we start, could you please tell me your full name and date of birth?
Yes, my name is Carolyn Witten, and my date of birth is June 27th.
Okay, perfect. Well, I'm going to explain you what we're gonna do. I'm going to take a little blood sample from your arm. This is to help the doctor to check your health. You're gonna feel a quick pinch on your arm, but don't worry, it'll last just a few seconds. So, any doubts?
No.
Okay, perfect. Can I proceed?
Yes.
Let's do it.
First, I wash my hands thoroughly to maintain hygiene. Next, I put on gloves and apply the tourniquet to the patient's upper arm to make the veins more visible. I ask the patient to make a fist and then relax it a few times. This helps the blood flow and makes the vein easier to access. I then locate a suitable vein and clean the area with an antiseptic wipe. I prepare the syringe and holding the needle at a 15 to 30-degree angle, I gently insert it to the vein. To ensure proper placement, I slightly pull back on the syringe or observe the collection tube. This confirms that the needle is correctly positioned into the vein. Once blood starts flowing, I fill the collection tube and monitor the process until we have enough sample. After removing the needle, I immediately apply pressure to the puncture site and cover it with a bandage. I safely dispose of the needle in sharps containers, remove my gloves, and wash my hands again. This completes the blood collection procedure safely and efficiently.
Okay, so Aldo, that's it. Please keep a little pressure on your arm. Do you feel okay? Yeah. Okay, the results will be ready soon. Your doctor will review them with you. Okay? Well, bye bye.
Thank you.
As a conclusion, blood sample collection is a fundamental nursing procedure that requires technical skills, patient communication, and strict adherence to safety and infection control measures. By following each step, like introducing oneself, identifying the patient, explaining the process, obtaining consent, and performing the procedure correctly, the nurse ensures both the accuracy of laboratory results and the comfort and trust of the patient. Proper technique and professional conduct contribute to high quality patient care and reliable diagnostic outcomes.